Thank you for joining us. This presentation will walk you through our integration of musical chairs with coping strategies and stressor identification. Let's dive in and explore our insights, perspectives, and takeaways.
To complete our needs assessment, we interviewed two nurses, one nurse aide, and two patients to gather feedback on unit concerns. During the interview, the health workers verbally stated that throughout the day there was a sense of boredom in the milieu. There are only a few outlets to engage patients in ways to promote healing and recovery. The longer the patients paced back and forth on the milieu, the more agitated they seemed to become. One nurse stated that clients often became bored after breakfast and lunch, leading to increased agitation. Through our observations of various activities that were occasionally offered, the patients seemed to respond more positively to music, dancing, working together, and engaging in conversation with each other, as evidenced by a large number of patients participating in activities such as Pictionary. From this, we found that there was a need for an active group activity we could provide during the unstructured milieu time. This active group activity would help patients move and dance to music and also bring the milieu together after breakfast or lunch, reducing the likelihood of agitation among clients.
An exploratory cross-sectional observational study was conducted to examine the influence of activity-based group therapy on the ability of people to cope and care for their mental health in an acute mental health ward. The study included 50 adults. The results of the study indicated that after just one group session, participants reported feeling more confident in coping, less anxious, and happier. By the time they were discharged, those who felt more confident early on were more likely to believe they could manage their mental health, leading to better overall well-being. This supports their PBL by focusing on how group activities like musical chairs and coping discussions can build healthy coping skills, reduce isolation, and improve well being.
A systematic literature review was conducted to examine the impact that activities had on patients' experience in acute mental health units. The study focuses on adults aged 16 to 65 years old with various mental health disorders who were admitted to acute mental health wards. The key claims identified in this study were participation in activities can help grow a sense of community, promote feelings of inclusion, and a decrease in aggression, self-harm, stress, boredom, restraint use, and anxiety. This article supports our PBL project by supporting our goal of increasing wellness and experience in an acute inpatient unit, promoting social engagement, and alleviating disengagement and loneliness.
My article, called Mindful Melody, explores when patients are agitated and overwhelmed, they are less likely to practice positive coping skills. Learning positive coping skills is vital to help decrease the cycle of readmission and increase patient autonomy. This quantitative article explores the use of music as a de escalation technique. The article uses 172 volunteer participants over 6 months, 3 months without music available, and 3 months with music as a de escalation option. The patients used surveys to report their feelings after using music to de escalate. The patients reported that music had a positive effect in lowering their levels of agitation. This article explains that music can assist with decreasing agitation and aggression, and conversely, increase the likelihood that patients are more ready to learn positive coping skills.
My quantitative article evaluated 18 to 35-year-olds, physical capabilities, and mental illness. Studies have shown that physical exercise can generate lower stress levels with the release of endorphins. This article supports encouraging light physical activity by promoting mental alertness, energy, and positive mood while decreasing stress.
This paper was a review of articles that were published between 2015 to 2020 that analyzed the effect of social support and social connectedness. The results of this article showed that a decrease in interpersonal support was associated with adverse mental health outcomes. Social support can be used in milieu therapy to help the client with emotional support, facilitating positive behavioral changes and social skills.
The goals of our activity included identifying adaptive coping skills, promoting social engagement, alleviating disengagement and loneliness, and encouraging light physical activity to promote mental alertness, energy, and positive mood. For our implementation project, we led a group-based activity designed to promote healthy coping skills and social engagement on the psychiatric unit at Castle Medical Center. The materials for this activity included chairs, a music playlist, a speaker, pens, and paper. Chairs were then arranged in a circle with one fewer chair than the number of participants, and participants helped choose appropriate songs for the playlist. As the music played, participants walked in one direction around the chairs. When the music stopped, they quickly but safely found a seat. The person left standing was invited to respond to one of the following prompts: share a past coping strategy, share a trigger or stressor with the group suggesting coping ideas, or sharing someone from their support system. Participants could choose to pass if they didn't want to share. One challenge that we faced was that a participant using a walker couldn't take part in the walking portion. To include them, we encouraged participation in the group discussion. Pre and post questionnaires were passed around to assess mood, stress, confidence in coping, group connection, and enjoyment before and after the activity.
The results showed that 50% of patients reported an improvement in their mood, 38% of patients reported a decrease in their stress levels, 63% of patients reported feeling more confident in using their old and newly learned coping skills, 63% of patients reported feeling more connected to others in the group, and 88% of patients reported that they enjoyed or extremely enjoyed participating in the activity. One patient somewhat enjoyed the activity due to difficulty with walking. Overall, the patients really enjoyed the activity. The patient's mood, confidence, and connectedness to others in the group improved while stress levels decreased. Staff stated that they wanted to add this activity and implement the pre and post activity surveys in their daily group activities.